Hypertension, commonly known as high blood pressure, is the leading cause of cardiovascular disease worldwide. It is often referred to as the silent killer because it may not present symptoms until significant damage has already occurred. According to the World Health Organization, over 1.2 billion people globally suffer from this condition. In this video, we will explore hypertension and detail its causes, types, pathophysiology, signs and symptoms, and management strategies. So, what is hypertension? It is a chronic condition in which the force of blood against the artery walls is consistently too high. Blood pressure is measured in millimeters of mercury and recorded as to numbers. Systolic pressure, the top number, is the pressure in your arteries when the heart beats or contracts to pump blood. Diastolic pressure, the bottom number, is the pressure in your arteries when the heart relaxes after contracting. Normal blood pressure is around 120/80 millimeters of mercury, while hypertension is defined as a persistent reading of 140/90 millimeters of mercury or higher. Let's now talk about the types of hypertension. Hypertension is classified into two main types: primary or essential hypertension, the most common form, which has no identifiable cause. It usually develops gradually over many years due to genetic and lifestyle factors. Secondary hypertension, this type has an identifiable underlying cause. Other type of hypertension is malignant hypertension. It is the term used to describe extremely high blood pressure that causes damage to vital organs. It is characterized by a systolic pressure of 180 millimeters of mercury or greater and a diastolic pressure of 120 millimeters of mercury or greater. This condition often requires immediate medical attention. Now, let's look at the causes and risk factors. For primary hypertension, there is no single cause, but several risk factors contribute. These include known modifiable risk factors like age, family history, and race. Modifiable risk factors include high salt intake, obesity, lack of exercise, smoking, excessive alcohol consumption, and stress. Secondary hypertension has known causes such as kidney disease, diabetes, narrowing of the aorta or renal artery, and endocrine disorders like Cushing's syndrome, hyperthyroidism, and pheochromocytoma. Certain medications such as oral contraceptives, steroids, and non-steroidal anti-inflammatory drugs can also raise blood pressure. Let's now understand how hypertension develops. Blood pressure is expressed as the product of cardiac output and systemic vascular resistance. Cardiac output is the volume of blood the heart pumps per minute. Systemic vascular resistance is the resistance blood encounters as it flows through the arteries. Since blood pressure is directly related to cardiac output and systemic vascular resistance, an increase in cardiac output, systemic vascular resistance, or both causes a rise in blood pressure, subsequently leading to hypertension. Factors that raise cardiac output include excess salt intake, fluid overload, liver failure, overactive sympathetic activity, or hormonal imbalances like hyperthyroidism. Increased vascular resistance may result from blood vessel narrowing or stiffness. Conditions like atherosclerosis, smoking, or activation of the renin-angiotensin-aldosterone system can also increase systemic vascular resistance. As cardiac output and vascular resistance rise, pressure within the arteries increases. Over time, the elevated pressure causes damage to blood vessels and vital organs like the heart, kidney, brain, and eyes. Let's look at the signs and symptoms. In most cases, hypertension has no symptoms and is only discovered during routine checks. However, malignant hypertension may present with blurry vision, chest pain, shortness of breath, palpitations, and severe headache. These signs require urgent medical evaluation. Hypertension is diagnosed through regular blood pressure monitoring, typically in the upper arm using a cuff. Blood pressure classifications include normal, below 120/80 millimeters of mercury; pre-hypertension, systolic pressure between 120 to 139 millimeters of mercury, and diastolic pressure between 80 to 89 millimeters of mercury; Stage 1 hypertension, systolic pressure 140 to 159 millimeters of mercury, diastolic pressure 90 to 99 millimeters of mercury; Stage 2 hypertension, 160/100 millimeters of mercury or higher. A hypertensive crisis is defined as a blood pressure over 180/120 millimeters of mercury and requires immediate medical attention. Management of hypertension involves lifestyle changes and, in some cases, medications to help control the pressure and prevent complications. Lifestyle modifications include eating a diet low in salt, exercising at least 30 minutes a day, maintaining a healthy weight, reducing stress, quitting smoking, and limiting alcohol. These simple changes can significantly lower blood pressure and reduce the risk of complications. Antihypertensive drugs are prescribed based on the patient's condition. Common medications include thiazide diuretics. These drug acts on your kidneys to eliminate sodium and water to reduce blood volume and thereby reducing blood pressure. A typical example is hydrochlorothiazide. Beta blockers. These class of drug lowers the heart rate and cardiac output. An example is acebutol, atenolol, and propranolol. Angiotensin-converting enzyme inhibitors. This class of antihypertensives reduces the effects of the renin-angiotensin-aldosterone system. Examples of this drugs include lisinopril and captopril. Calcium channel blockers relax blood vessels. Examples include amlodipine and nifedipine. Angiotensin to receptor blockers, such as losartan, block blood vessel constriction. Alpha-1 adrenergic blockers, like doxazosin, cause vasodilation. Vasodilators, like hydralazine, directly relax blood vessel walls. Complications of uncontrolled hypertension include heart attack, heart failure, stroke, kidney damage, retinopathy, and aneurysm formation. These complications can be life-threatening and are a key reason why managing blood pressure is critical for long-term health. In summary, hypertension is a serious but manageable condition. Early detection, proper medical care, and healthy lifestyle habits are essential for controlling blood pressure and preventing complications. If you found this video helpful, please like, share, and subscribe for more health content. Thanks for watching.